Good morning, Jeffco. So this is Shauna with Jeffco PTA, and we are so very fortunate. So we have Dr. Mark Johnson, who just retired from Jeffco Public Health. So from an amazing career, and of course ending it with a pandemic. So woohoo! That's the one way to go out. And of course we have Julie Wilken, so from the Jeffco School District, who is also the lead on our COVID task force for Jeffco Public Schools. She's phenomenal. We're going to go ahead and just kick right off. So Dr. Johnson, I will share your slides here and you let me know how else I can help.
All right, thank you very much, Shauna, and good morning, everybody. Thank you for inviting me to spend my last official duty with you all. I appreciate that. I think the circumstances over the last couple of days have maybe made a lot of people sort of stop and rethink some of their positions on what's going on with COVID as we look at the governor and the governors around the country, as well as the president and his wife and members of his staff coming down with COVID-19. It has, I think, given everybody pause anyway to kind of review what they do and how they do it and what exactly is going on. Let me begin by sort of updating you what's going on in the state of Colorado and in Jefferson County, and then touch on a couple of the hottest topics that we are having right now around the schools. And then we will also stay around in case there are questions and answers, because I'm sure Julie will also be touching on some of these. So I don't want to go too in depth on those, and we can then answer questions afterward. In Colorado, we have now had almost 72,000 cases of COVID-19. Of those cases, we have had just about 2,000 deaths. And I say just about because it's a little bit different if you look at those that have been diagnosed as dying from COVID-19 or those who have died with COVID-19. But both of those numbers are very close to 2,000. So that's where we stand on the state level. In Jefferson County, we have had just over 6,000 cases of COVID-19 and 254 deaths. As of yesterday, we had 24 individuals in the hospital right now with COVID-19, and those cases can be very severe. They may be in the ICU with ventilators. They may just be in for treatment and for observation, as is our president right now. So the hospitalization can have a wide spread of how serious the disease is. I think for this audience, it is particularly important to point out that we have had only a little over 11% of the cases that we have had in Jefferson County have been in individuals who are less than 20 years old. And that 11% compares to the fact that of the population, that group is about 22% of the population. So it is much less represented than what you would expect if this was hitting everybody equally. I've had a lot of questions as to what is going on in the minority population in Jefferson County. We do not have a very large Black population, but the case count among Blacks is almost identical to their percentage of the population. But in our Hispanic population, they have been 26% of our cases, and they are only 15.5% of the population. So they have been overly hit by this. There are a number of thoughts that have been brought out as to why this may be, but the ones that seem to make the most sense are that our Hispanic population does overrepresent some of our frontline workers, both in hospitality, restaurants, at hospitals and nursing homes, places like that. There is also more multi-generational homes among Hispanics in Jefferson County, and they need to use public transportation, or do use public transportation, more than the white majority in our population. And all of those factors do increase their risk of coming in contact with somebody with COVID and being exposed. The majority of our cases right now are in the 30 to 49-year-old population, and right below that is our 20 to 30-year-old population, or 20 to 29-year-old population. Originally, you probably all have heard that it was hitting those who are in the older population, as well as those who are in congregate care situations. That has changed as we have moved along. And because of that change, we are seeing less hospitalizations and less deaths currently as well. We have had no deaths in the population under 20 years of age. And we have had about 90% of the deaths in Jefferson County in those that are 60 years old and over. Just a couple more data points, and then I will discuss the charts that we have. One of the measurements that has been talked a lot about is what is the positivity rate of the testing that is being done. And in Jefferson County, we have two measurements of that. One is the positivity rate over the last 3 days, and one is over the last week. Over the last week, our positivity rate for those who have been tested is 2.75%, but over the last 3 days, it has been 5.6%, which is an indication at this point of something to watch closely, but we are not yet at a point where we are terribly concerned about that. We would love to see the rate stay below 5%, but we're watching closely to see if that is going to continue to be over 5% or if it's just a blip over the last 3 days. I would now like to turn to the slide that hopefully you can all see. This is
Dr. Johnson, sorry to interrupt you.
Yeah, Julie.
Can you please explain to everybody what exactly the positivity rate means?
Sure. Thank you, Julie.
Sure.
The positivity rate basically means of everybody who has been tested for COVID-19, how many of those tests turned out to be positive. And I need to clarify that even more. Those that are looking at the molecular test, meaning it is the PCR test or the test where they actually usually do a swab way back in the nasopharynx. Those are the tests that we use for this metric. And it is a test that actually finds a portion of the RNA virus of the coronavirus. The other test that is being done more and more is called a serological test, and it actually does not look for the virus itself. It looks for whether you have been exposed to the virus, and the attribute that shows that is, do you have antibodies against the coronavirus that causes COVID-19? So when I say the positivity rate is 5.6% over the last 3 days, it means that of all of the molecular tests that were searching for the virus itself that were done in Jefferson County over the last 3 days, 5.6% of those tests ended up being positive. Probably you all are sophisticated enough to know that every test is not perfect, that there can be some false positives and even more concerning false negatives in any test. That's what the sensitivity and specificity of a test look for. With a molecular test, false positives are fairly rare because you actually have found a piece of the virus itself. But false negatives are fairly high because it's not always, the test is a difficult test, it's not always done well, and quite often you will get a negative test even though eventually it turns out that the person did have the disease itself. But that's what the positivity rate is. Thank you, Julie, for bringing up that point. If you look at this chart, this is a chart of all of the cases that we have had in Jefferson County going all the way back to March. The orange line is an average of how many cases have we had over 2 weeks. It helps to sort of smooth out the curve instead of having the daily up and down. And that is the 2-week count of those, if you do not count the outbreaks that we have had in places like the congregate care, skilled living homes, nursing homes, those kinds of places. So that's really the one that we look most closely at. The blue line at the bottom is the outbreak, and as you can see at the beginning, particularly in April and May, we had a lot of cases coming from skilled nursing facilities and assisted living facilities. That has pretty much died out, and now we are pretty much getting only those cases that were not related to the outbreaks. The reason we make a difference there is that in the state has set various parameters as to the phases of how we can open up the economy and open up our society, and they do not count those blue line outbreak associated cases in the numbers that they give us for our thresholds. So that's why we divide it out this way. As you can see, we had a very steep curve in March and got to the point where we were having over 500 cases over a 2-week period. That then slowly came down over April, May, and into early June. And then we associate it with July 4, but you can see it actually started a little bit before July 4. We had what some people are calling a second wave, what most of us in public health are calling a continuation of the first wave, where we had an even higher spike, where we got up into around 700 cases over a 2-week period in July and August. And it was at that point where we put into effect, both at the state level and at the county level, a mandatory mask order. Prior to that, in Jefferson County, we had been strongly encouraging masks, but it was not a mandatory public health order. After we put that into place, we began to see a rather rapid decrease in the number of cases, which then sort of leveled off. And then we are attributing to Labor Day another spike that we have been seeing here since early September. And if you look at the very last bit, we see the last couple days, it's beginning to drop down again. We're hoping that that is a trend and that it is going to continue on a downward trend as we move forward. We, of course, have Thanksgiving coming up and Christmas coming up and all sorts of issues that may have to do with holidays. We also have cold weather coming up where people will be moving more indoors instead of being able to eat at restaurants outdoors and have outdoor family gatherings and those kinds of things. And I'm sure all of you know that indoors is more risky than being outdoors, and we have some real concerns about that. We also have the fear of what might happen with influenza as we move into the flu season. It is interesting we always watch what's going on in the southern hemisphere because that gives us an indication both of which type of flu is coming and also how serious it's going to be. And we have seen over the last several months in the southern hemisphere that they actually have had a very light influenza season. They attribute it mainly to the fact that everyone is wearing masks. And if you talk to pediatricians, they will tell you that over the past 7 months or so, they are seeing a lot less colds and flu and respiratory infections, which they usually attribute to mask wearing also. So we're not really sure what's going to happen here with influenza. It is going to probably complicate the diagnosis and treatment ability of those with respiratory infections as we get into the winter months. But we have some hope that perhaps it may not be as bad as it has been in the past based on a lot of the things that we are doing to respond to COVID as it is right now. Ashana, if you could give me the next slide.
Absolutely. Can I ask you one other question? As
Surely.
Families and parents, Halloween is also coming. And, you know, it is a pandemic. And I just want to ask you honestly, what will you be doing at your house for Halloween, giving out treats as, you know, kids and families come to your door? How would you respond personally?
Yeah, that's an excellent question, Shauna. And actually, the State Health Department came out this week with guidance for their suggestions as to how to deal with Halloween. What we are planning on doing at our house is basically setting up a table out in front of our house with candy in individual bags, individual sacks, and then giving those out individually instead of having kids grab out of a bowl or those kinds of things. And again, if you are going to have your kids go trick-or-treating, I would wear a mask, a real mask, not a Halloween mask, if possible, and make sure that they are social distancing. And for the most part, absolutely don't go into any homes, and stay as far as you can away from folks that are giving out any candy. This may be a good year to find another way of celebrating Halloween, but there is some guidance that has been put out by the State Health Department that is fairly good if you go to their website.
I will add that. Thank you.
Thank you, Shona. If you look at this table, this is a table looking at the almost 700 cases that we had in Jefferson County over the period between September 1 and September 23. And by using contact tracing and case investigation, trying to figure out where did these people get their infections, and for your interest particularly, what is happening in the schools. As you can see by the very bottom number, we only were able to track about half of these. About half of them we either were unable to find out the information yet, or they are still being investigated, or some of these have been turned over to the State Health Department. Mostly on the weekends, those go to the State Health Department and they do the tracking, and they have not yet put them into the database that we use to find out exactly what they found out. So from about 350 cases that we had in September, you can see that they break out with the majority are coming from, or the plurality are coming from the workplace and workplace and social gatherings, about 60 from there. Most of the rest of the spread, or I should say most of the spread, does not come from the schools. And even those cases that are showing up in the schools, for the most part, have been able to tie it into what's going on at the house, the household spread, or from social gatherings that they have had. Again, Labor Day, there were a lot of parties or barbecues or family gatherings, even trying to have them on the back lawn and those kinds of things. You know, if you've watched some of the events that have been held at the White House, even though they're outside, sometimes there's a lot of mingling, and depending on whether you're wearing your mask and keeping social distancing, it can really increase the risk of spread. Travel is also another big item here, particularly those who have been traveling to states that have had high outbreak rates, such as California, Arizona, Texas, and Florida. Those places originally in early September were the areas where we saw the most spread. And then it breaks out with a number from particularly School of Mines and colleges, and you can see that list there. But particularly I wanted to point out that from at least early September, when schools were first opening, we did not see a lot of transmission in the schools. We saw some transmission, but for the most part, kids that were getting sick in the schools could tie it into something that was going on at home. And quite often those at home could tie it into something that was going on at work. So I thought that might be interesting for you to see. That basically is kind of the situation. The two hot spots there are hot topics that we have been dealing with, Julie, and with the schools, have been around sports. And I will let Julie sort of touch on that. And if not, we can answer some questions later. But we essentially are following the CHASA guidelines on sports with a few little changes. And the other is just to let you know that there is a brand new document that has come out from the State Health Department called Cases and Outbreaks in Child Care and Schools, giving guidance particularly with some algorithms as to what to do if somebody does get sick at school, or if you have somebody at home that's sick, what do you do? And there is a 22-page guidance that has just come out from the State Health Department. We have a smaller group in the Metro Denver area called the Metro Denver Partnership for Health, which is the health department's in the local Denver area, we're trying to take this 22-page document and make it simpler. And so hopefully this next week we'll be coming out with a bit of a simpler, hopefully more easily understood and able for parents and teachers to be able to sort of follow through a little bit easier as to what this guidance actually says, and also a frequently asked questions, a document for parents. So I will listen to the rest and be ready to answer any questions that you may have, but thank you very much for the opportunity of presenting to you.
Thank you so much. We appreciate your service to our community. You've been wonderful, and we're grateful that you're in place. Except you're leaving us. But thank you for everything. Julie, I have shared and made you a co-host too. I'll just let you take it away.
Okay, thanks, Dr. Johnson, for all that information. Thank you, Shauna. It's good to see everybody here today. Dr. Johnson, we are going to talk a little bit about sports and some of that. The guidance that he's referring to takes place starting Monday. It says it's in effect. We, though, usually here in Jeffco, we take our COVID response team and we review the guidance that comes out, and then we make our own adjustments to how we are already operating. So we are going to take a look at that really closely over the next week. And like he said, if they come up with a cheat sheet, that'd be great, because it is a lot of information. And when you're looking at a 22-page document, especially for people that don't commonly use the language, it's difficult to understand all that. So we're going to do our best over the next week or so here in Jeffco. We might be changing some of our practices, some of the way we've been quarantining. We're going to have to see and wait. We've obviously been affected by it, and he's right. We can't tell a lot of the cases that have been, school transmitted per the schools, but we can tell that most of them are coming from households and passing through households. So that seems to be what, when we have, spoken to staff and students, we've gotten the same responses. So I'm going to go ahead and share my screen. Can you see it, Shauna? Okay.
Yep, it's beautiful.
Thanks. All right. So I put this slide up here because, people ask me all the time, so now that you've seen this, is it what you expected? And I look at it and I think we've got this huge stairs. We've got these stairs to climb. And sometimes I do, and so does the other members of my team, stand at the bottom and think, how are we ever going to get to the top and get over this? And to be honest with you, each of us have taken a step back. We were overwhelmed in the beginning, thinking we're never going to get through this. But honestly, it's climbing it one step at a time. Eventually, we will get to the top and we will get through this. So we continue to look at that as some hope and know that, we've got perseverance on our side. We'll get through it. Talking about the expectation, we know we're going to start down here towards the bottom, and someday we're going to get to we're going to get to where this arrow is. And even though for me, and a lot of people tease me about, this isn't the way you have everything planned out, Julie. And I say, you're right, because I'm a planner and I stick to what I do. So in reality, for my world, I like to go to the straight line, but this is what we're ending up right now. And you know what? Again, we will get from point A to point B, but it's going to look messy in between like this. And we are learning as we go. We are going to change some of the ways we practice. We're going to change some of the ways we do things. But that's because as we learn a better way and we understand more, we're going to make it better. So be patient with us as we change things, because that's going to be a big part of this. We don't want to stick to old quarantining ways if we don't have to necessarily. So we want to encourage everybody and know that we're working hard on this every day because we want to make it better.
So Julie, can I just clarify a rumor?
Sure.
That
Absolutely.
posted on a few different places on social media. So there have been a few people saying that the school district is not working with Jeffco Public Health. And I believe, based on our phone call right here and emails, that is false. But I just want to clarify that, because it seems obvious to me that you are.
Yeah, it's very interesting. I've heard the same things. I don't know. I mean, the two epidemiologists that work, right with Dr. Johnson, I meet with them at least once a week, if not 2 or 3 times a week, and have since March. We brought them in. We have our athletics director and our stadium people working directly for athletics with another person that works under Dr. Johnson. They come to our weekly meetings. It's on an ongoing basis, and we've collaborated really well. When you see our letters, it has both logos on it because we were both a part of that, and we both approved what was written in there. So
thank you for clarifying that.
You're welcome. Absolutely.
If I can just break in also, Shauna, we have been working extremely closely together. In fact, we are hiring an epidemiologist whose total focus is going to be working with the schools. And as Julie said, we have been meeting together for months, actually since even before the schools closed. I think that perhaps there may be some concerns, or maybe some of the reason is that with the change in leadership at the school district and with the change at leadership here in Jefferson County Public Health, we may not have been constantly in touch as much as perhaps some of the other county health departments in the area have been. But as Julie said, our staff, the ones who really are getting the work done, have been working together on a daily basis. So although, Superintendent Glass and Interim Superintendent Shu and I may not be meeting as frequently as some others, our staffs are working together very, very closely and keeping us informed as to what's going on. So that's an unfortunate rumor that is not true.
Thank you. Thank you for clarifying that. We will make sure that PTA is on top of dispelling those rumors. So thank you.
Sure. So one thing that has come out over the last few weeks is we've worked hard with the data that we have to come up with some sort of dashboard. And as you can see, this is what it looks like overall. I want to take you to the actual dashboard and kind of go through it with you. Some of you have seen it in our community updates. Some people have asked for this. In the beginning, we weren't sure how and what to do. Should we provide it? Should we not provide it? We did believe that true transparency is better. To a degree, though, we want to make sure that we are protecting people's privacy as we're coming up with trying to figure out how to, be thoughtful about how we present this. At the top of this website, you can tell there's a little bit of right here, a disclosure on here, to let people know that this dashboard does not differentiate between staff and students. We do not want to identify either or. I believe that that's too much finger pointing, and I don't think that that's going to protect people's privacy. And in the other way, even if we have remote cases, so children that are learning remote, if we find out about them, we will include them in on the dashboard. So sometimes, and that is a true reflection in the letters that we're sending out, to let people know. We're not going to say it's a remote student, but we're going to say the person, this person has not been in the building. So we want to make sure that we make that clear. The charter schools are not reflected in this data. They are going to do their own data and have their own thing. So I want to make sure that everybody understands that as we move forward. This is as much transparency right now as that we're willing to give, because we are protected of the staff and the students and who they are.
Well, I think
so. How to use this? Good, thank you.
I think it's very transparent, and as you know, my daughter's out of school where I've gotten a few letters recently, so the non-contact, letters. So it has been really helpful to look at this and alleviating fear, I think, for me and other parents as well. So I'm grateful to you for this.
Thank you. So it's interesting too. There are several cases who, they get tested or they actually live outside of the county. And sometimes that doesn't go through our Jefferson County Public Health. So we find out different ways too, in addition to, Jefferson County Public Health. There is a little how to use information right here, but I'm going to go through a little bit and explain to you guys what this means. So total, and I am the one who inputs the data every single day. So I'm aware of what this is and how to read it and how to use it. The total active cases that we have right now that we know about is 59. That would include staff and or students. We have a really good system set up where we have dedicated 2 COVID resource nurses to be the support for employees and staff. They are working, you know, side by side with Jefferson County Public Health, again, with their epidemiologists and their case investigators, because we want to make sure that we're asking the same questions that the county health department would ask. We're trying to, and the whole point of this is because sometimes, like Dr. Johnson said, the data collection portion, at times can run a few days behind. We want to make sure that we're doing everything we can to identify what could be and to contain it as fast as we can, and then make sure that we are quarantining appropriately so that the schools do not become a vector of spread. So looking at total active cases, we're looking at 59, and then total cases eligible to return. Originally, this was how many cases had recovered, but then people had asked, well, what does that mean? People didn't recover? So yes, of course, people recovered. Dr. Johnson gave you really good statistics earlier. And what we want to make sure is that we are, as we add cases, we're also taking them away. So to make sure that they've gone through that time period of quarantining and they've met the criteria to come back to school, which means they have, you know, in most cases, people will say they need to self-isolate, and that's state recommendation as well as Jefferson County Public Health's recommendation is to self-isolate for 10 days. In the school system, we have changed that and lengthened it to 14 days. And the reason being is because we want to match it to our cohorts. So when cohorts are out and we are quarantining people, we want to make sure that that person who's positive doesn't return a few days before the cohort that's quarantined. There won't be anywhere for that person to go, right? Their cohort's gone, still quarantining. So we want to make sure that we're keeping everybody on that 14-day schedule. So as they return and they've met that criteria, as also as they've met the 14 days, they are fever-free for 24 hours, and they are almost completely symptom-free as they return. We do not require a test. I've been asked that several times. Do you require a test of negative to come back? We do not. And as they come back, we're putting them back into the total cases eligible to return. So when you look over here, you've got the school name. You can scroll down to the school. Total confirmed cases will be as many cases as there are from the beginning of time. But remember, the beginning of time for this dashboard only starts on 8/31. So yes, of course, there were other cases. And yes, of course, we have some documentation on that. But we started this dashboard on this day, so this is the day that we're going to start. Total cases eligible to return. So you can tell something like this on Arvada K8. There may have been 3 cases since August 31st connected to that school. That does mean directly staff or students. It doesn't mean parents, grandparents, and all of that. It does mean staff or students. We know that 1 has returned to school and there are other 2 active cases. So when we say there's an active case, we have done our best to figure out what cohorts those are in and make sure that they're quarantined during that time period. The cool thing about this is that if you want to look at high schools, you can click on this purple spot and it will take you just to the high schools. You can go to the middle school, it will take you to the middle schools, or you can go to elementary schools and it will take you there. You can do the exact same thing over here with the boxes. You can search by date in here if you want to look for, like Dr. Johnson said, they go by a 2-week and they go by a 3-day case. You can put that in there if you want to compare. Anytime that you're done, you just reset visuals and it goes back to the home page. You can also search by articulation area. This is sort of a Jeffco term, Jeffco Public Schools term, articulation area. But what we identify as an articulation area is what feeder schools feed into the high school area. So when you look at Arvada West and pull that up, you can tell all the different ones that feed into that have some cases right here. The next thing you can do is even when you, so I'm gonna go back and reset, And then I can search up here by school too. So you can go down the school alphabetically over here as well. So if I pulled up just Dakota Ridge High School, it will show me the days that they were inputted. That doesn't necessarily mean the days they were tested, the days they were symptomatic. What it means is the day that I put the data in, okay? And then what we know is that this whole dashboard lags behind 24 to 48 hours. So when this first went, when this first was posted and became public, I had several people calling me saying, that's not correct, because they're really watching their own school the most. And I wanted to make sure that they knew, you know, we are updating every night. However, on the weekends, there's lag time when we don't update. And then also, for once I input the data, it does take 24 to 48 hours for IT to update the dashboard. So that's how that works. So far, we've had good results with it. It's helped answer a lot of media questions. And I think for the most part, people have been pretty comfortable with it. Over time, you're going to see, you know, as you look at this bar graph, like Dr. Johnson had with his lines, you're going to see the up and down, and we're going to be able to watch the trend as we get into the cold season. And I think that'll be interesting to see. You know, right now, when we only have 6 weeks or so of data, it's going to look a lot different when we have 6 months or even 12 months, 18 months. Okay. So back to this, want to go to the next slide. Are there any questions regarding the dashboard, or did you want to wait till the end? Okay, we'll just go to the end and then we'll come back. So what can parents expect when there's a positive case at school? Our nurses are working a lot of hours right now. Most of our school nurses are working with our students. And then, like I said, we do have a COVID response team that's led by 2 COVID resource nurses that are working with employees. We've paired and partnered with human resources so that we can help our employees quickly fill out a form and help them with their leave. Most of the time, a lot of our employees can just go straight to, as they quarantine, they can just go straight to working remotely, and they don't have to take that time off. But there are a lot of employees that do have to take that time off, like Dr. Johnson was talking about some of our frontliners. If you're a bus mechanic, if you are a food nutrition worker, you can't do your job from remote. So those are the people that we really need to work with from a human resources standpoint to make sure that they have the resources they need to have the time off. So what we have come up with actually Dr. Johnson's incident commander, Christine Billings, we've come up with 3 different letters. One of them is a quarantine letter, one of them is a non-impact letter, and then the other one is a 24-hour closure. Again, these letters could change throughout the year. They really could, depending on how we continue to work through the schools and how we continue to battle this. Our quarantine positive letter means that if you have been directly impacted and directly exposed to a positive person, either a staff member or a student, you will receive the quarantine letter. So remember, this goes to anybody who's in those cohorts. Okay, so whether it's elementary, middle school, or high school. And this has been a very frustrating process, especially for our middle and high schools, because we have other things involved like sports. And when you are quarantined, you cannot participate in sports. So people have asked me, well, Julie, and they find out who the student is, which I'm never okay with that. When somebody calls me and says, my daughter knows who it is. And I say, well, they shouldn't know who it is. So we're going to do our best to protect that identity right there. But when the frustration comes when the parent says, now my daughter's quarantined and she can't play softball because she knows who the kid is and she sat 25 feet across the room from him. So we understand that. However, that is our process right now, because as we started this 6, 7, 8 weeks ago, our best, most manageable way to contain and report and figure out quarantining was to do it by the classrooms and by the cohorts. The other part to that is to really not be able to identify who it is. If we start working around somebody who's right next to another person, that will be a lot easier to identify who those people are. And that's just not something right now that we want to do. Again, this can progress. There is new cases and new guidance that Dr. Johnson talked about coming out from CDPHE. We are going to take a look at that and see what we can implement within the next week. We do want to make sure that we're fair, that we're doing it correctly, but yet also protecting everybody involved. So the non-impact letter is sent to everybody else, including staff and students, because people now look at the dashboard and say, hey, there was a positive case, but nobody told me. So we want to make sure that we're letting you know, yep, there might have been a positive case, but if you're getting the non-impact letter, you are not affected by this. It is business as usual. Please return to school. Please come back and do the things you always do. The 24-hour closure letter is really when there is an outbreak, and an outbreak is defined as 2 cases. And I did recently talk to Melanie, our new epidemiologist, and Christine. We might be changing that to 3, but right now it is 2. So if there are 2 cases within the school, that 2 individual cases that may indicate there's an outbreak, we are just closing for 24 hours to do a deep cleaning. That deep cleaning consists of a crew coming in from our custodial services, doing the electrostatic sprayers throughout the building. We're letting it sit for 24 hours, and then all of the non-affected cohorts can come back the next day. So right now, that has been our process. We will continue to take a look at that, like I said, and change that as we progress. The quarantine process, again, is a hyperlink, and I put that in for you, Shauna. It really is the transparency of how we're quarantining and what the process is that we go through when we consider that. And it's not easy. When we start thinking about some of these high school kids that have been in different activities, in sports, in different classrooms, we really try to do our best to contact trace that back. Again, it's not a perfect scientific method, but we're doing our best with communication to try to contain and make sure that we're doing everything we can if we think you've been directly exposed to stay home and follow quarantining.
So Julie, there's a quick question here too on 2 cases within what time
with
period?
a 14-day time period. Sorry, I did not mention that. So it's within a 14-day time period. So Shauna, something else that you asked me to go over is how sick is too sick. One of our questions in trying to screen people is if you had a runny nose. And has that come to, yes, we've gone through a lot of that, trying to figure out, is this allergies? Is this not allergies? And again, there have been some parents that have been upset. We have sent students home with runny noses. And it is very difficult to come up with, is this an allergy case or not? But you know what, if it is, we're in a different time period. What used to be okay to send your kid with a runny nose to school is not anymore. And we are going to take that very seriously. The interesting other part that the epidemiologist and I worked on last week when we met was we took a look at all the kids that had that we have data on from the county who have been positive, ages 2 to 19. And we took a look at what their symptoms are, and we tried to rank them. And we tried to rank them by what is the percentage that have come up. And when we take a look at runny nose was about almost 40%. So almost 4 out of every 10 kids are complaining of a runny nose. And those are of the ones that have already tested positive. One of the other higher symptoms, of course, is cough and sore throat. So looking at all of those, headache was also a very high one. So taking a look at those, it is hard for us to differentiate, is a headache a migraine, is a runny nose part of allergies? But we are going to do our best that day. Once you've missed a day or 2 of school, you should be hearing from the nurse, because she is going to talk to you about those. Have you normally had, runny noses? Is this normal for you? Does the child take any Claritin, Zyrtec, any type of allergy medicine? What can you do to contain the runny nose? Because what we know right now is that we can't have the students coming to school with runny noses. We just can't. So we're taking that very seriously. We know that it could be allergies, and we apologize for that, but we ask that you try to do your part too as parents to keep your kids home. We have added this from CDPHE. This is new guidance to our website when children and staff should stay home from school. It talks about the major symptoms of COVID-19. It also talks about the minor symptoms. Underneath, we have listed 5 main reasons to keep your kid home from school. And that would be somebody who lives with the student or family member who has had close contact or been diagnosed with COVID-19. So yes, if somebody in your household is positive, let's say mom is positive, please do not send your kids to school. We want them home, because what we know is, as you saw with Dr. Johnson's table, household spread is huge. That's one of the largest categories. So we want your children to stay home when somebody in the household has been diagnosed with COVID-19. Number 2, the child or staff member does not feel well enough to partake in activities, overly tired, fussy. That's really for the little kids, because we've had a lot of preschool parents ask us, how do we know? So kind of pay attention to some of those warnings. A child that needs more care than the teachers can give, or the symptom is on the list and staying home is required. So, like I said, all of these symptoms that are up here in major and minor. And then also the 5th one that we've come to realize, collecting all of this information the last few weeks, is if you're going to get tested, while you're waiting for test results, please stay home. This is a big period of time where you're being tested for some reason. We don't know why. In some cases, there were high school students going in for surgery. They were asymptomatic, got tested, but we sure wish they would have stayed home until they had their results, because in the meantime, the time period that they were at school and they did test positive, they didn't think they had it, but they ended up having it. So we want to make sure that if you are getting tested, please stay home. We need that from you until you get your results back.
Thank you so much for covering that. That's one of the top questions we've had with the flu and cold season coming upon us.
Sure.
One of our other parents here too had a question about, for high school students, is there a process for switching them from hybrid to remote? And I mean, I can tell you at my high school, that is definitely, we do. So, because the hybrid kids are going to school in cohorts. So one day, A through whatever last name goes, and then the day after, F through another section of the alphabet goes. So you would join the other cohort and be the remote part, because we're actually only going to school those twice a day. Do you have anything to add to that, Julie, in case there's something different at other schools?
No, that's correct. There is a process. If they do want to go to remote and not stay in hybrid in person, they do need to contact their counselors. But right now is not the time, because we're right in the middle of October count. So we need to wait for that 10-day window period to end before they can request remote.
Oh, she meant also in the event of a household exposure. So yeah, Christina, I'm thinking probably what happens if you did have, or let's say my daughter gets it or something like that. And I'll just use myself and pick on my own family. So if my daughter gets it and she's quarantined, or maybe she's quarantined and we're waiting on testing too, she would stay home and she would go to school. She would not go to school at all. So she would stay home and not go to school in class with her cohort. She would be remote with the other cohort and just stay home until, I assume, we get notification or get beyond the 10 days, when we need to quarantine, or until she's well. And then Tim wanted to know too, will the cohort model remain in effect next semester and next school year, or is it too early to tell yet?
Too early to tell yet. That's all I can say. We're planning ahead as much as we can. We have a feeling it will still be in place probably next semester. And hopefully by next year, we will be in a different era, but we don't know yet. We don't know that yet.
We're still in the fuzzy line stage, right?
Yeah, we're still curving around like this. We're not
Yeah.
there yet.
Yeah.
The one part I wanted to throw in was that in the educational world, I always wondered when I got here from having a health background, is why were the nurses and why was the public health side not as important in the educational system? And since the time that I've been here in this position, I've really fought hard to make sure that we do recognize the health of everybody and not just from a pandemic standpoint. I do think that nurses for many years felt like in the school system they were not integrated well and not a part of this, and they sure are now. So we are very thankful for all of our school nurses. They have worked extremely hard since July. They're still working hard. Many of them are putting in additional hours at nights and on weekends to make sure that they can call families. And, you know, we care about the students, we care about them being in school, and we want to make sure that, you know, everybody is top notch and safe to be in our schools. So they've really, I wanted to really give a shout out to them because they've done a very, very good job, and they are all in this for the best of the students and the staff.
I agree. You've done a phenomenal job since you came to Jeffco too, in promoting this, and thank goodness you're here. Boy, we had no idea how badly we would need you at this point. So huge, huge thank you. Lori had just asked a quick question too about how available is testing for students and staff. And actually, I will share in the comments again further up. Jeffco schools, both the letters that come from our schools when there's, you know, an issue or there's been an issue in the school, and our community letters have actually been including links to sites that offer that free testing. So, and from what I spoke to too, even interim superintendent Shu, you know, popped up at a meeting the other day too and said, you know, his daughter had, you know, been in the health room or something, and they said, you know, she developed a runny nose. So, and he just, you know, ran over to the Water World testing site too. But the link that they give us actually goes by location within the entire state. So as we know, since Jeffco is huge, so we go all the way over from the mountains to, you know, just the Denver border, and we go all the way north and all the way south. It's a gigantic county. We have testing sites all over. So the Jefferson County area, and those links are in that district site. So I can share that link again in the chat. So if you didn't already see that one, and I'm happy to send it to anybody, but the community newsletters are covering that for family members too. So we do know what to do. So if something happens, so even the non-disclosure letter, I believe, or non-incident letter, what's it called?
Non-impact.
I literally just got one this morning. So yeah, it's got so much great information and a link to the database. And so we are so grateful to you. So yes, and Pepsi Center is not a testing place anymore. It is in that link that I shared in the chat earlier. So, and I can share it again if you need that. Julie, huge thanks. You're amazing. Please get some sleep. I know how hard you're working. You're wonderful, and we're so very grateful to you. Boy, there couldn't be anybody better here in Jeffco. Thank you. And Dr. Johnson, thank you. You are all wonderful. I am going to make some changes to how I'm going to do Halloween, and we love you both very much, and we're so appreciative and grateful to you for giving us some time on your Saturday. And we're here if you need anything else.
Thank you very much. Appreciate it.
Yep. Thank you guys very much.
Thank you. You have a wonderful day. Thank you.
You
Oh,
too.
you're getting applause if you can't see it. You're wonderful. Thank you. Everybody have a wonderful day.
Thanks, guys. Take care.
Bye-bye. Good to see you, Lori.